Hey everybody, Dr. Rob Silverman here. I'm with Dr. Brent Dorval from Kbmo. I'm excited. We're going to talk about a breakthrough test here. That test is going to be a new PCR test that's going to really show you the extent in which we can test for. I got Dr. Dorval here. He's really busy. I got him for about a half hour, 45 minutes. So do me a favor. After we cover the confines of what we're going to do, ask some questions. I'm going to ask him some questions on my own. Ask some questions, like, click, share it, let everybody see this. Dr. Dorval, how are you today?
I'm well. Thank you very much, Dr. Silverman. It's a pleasure to be back and happy to discuss some of the new testing that we're doing at Kbmo Diagnostics. So as people may remember, I'm the Chief Scientific Officer of Kbmo Diagnostics. My background is in infectious diseases. So hence this coronavirus, since the pandemic started, it's an opportunity to use what I know and help provide good diagnostics to the medical community so that we can likewise provide good care to your patients. So thank you again for that. So today, I'd just like to discuss briefly the new the Rt Pcr test for coronavirus. So COVID-2 or COVID-19, depending on what literature you read, SARS-CoV-2. The test measures by PCR the RNA genome of the virus. And how we do that is we use a kit that has a number of probes in it that look at they call it the open reading frame of coronavirus. So, or you may see ORF 1A, 1B. That's just a fancy way to say that's the beginning part of the genome. It's codes for a lot of proteins, and we've chosen a number of constant regions in those proteins so that we can get nice and specific measurement. So basically the way we approach this is we'll send the patient a kit, and that contains a swab like many other kits do. You take a nasal swab of the nasal cavity. It's not a brain swab like some of the others, it's the nasal cavity. And you put it in the transport tube, you send it back to the laboratory. Then within 24 to 48 hours, you can expect that the healthcare provider has the report in their hand. Our interpretation as to whether that's positive or negative is included, and then you can present that to your patients. Now, having said that, the nice feature about this test, or essential feature about this test, are really a couple things. Number one, it's very, very specific. So it does not detect other coronaviruses like the common ones that we've talked about in past lectures with or appearances with Dr. Silverman, either the 229E, the OC43, MERS and SARS, the historical coronaviruses that had been infected in 2004 and even 2013-14. So it does not cross-react with those viruses and then other viruses that cause common colds, common symptoms that are also associated with coronavirus. So that why that's important is if you're positive on this particular test, you can say with certainty, or relative certainty, I mean 99.5% certainty, that that patient is positive for this particular virus and not something else. So those are excluded, which it's the needle in the haystack, and we're able to pick the needle out for you. The other important thing about this test, and very important, is it does have approval by FDA. So that is a to me, again, James White is the CEO of this company, very astute individual, and he knows what to look for in a diagnostic, much like myself. So we want to make sure whenever we can that we get the highest level of approval for these particular tests. So this one has approval at that level.
Yeah, I want to ask you a question.
Yes.
You gave so much good information. PCR test. So
Yes.
it's funny that you mentioned it. So many people say, oh, yeah, it touches my brain. I've
Yeah.
had multiple tests. We were talking about it before. So the PCR, that's testing for the whole virus, not a fragment.
That will test for the whole viral genome. That's
Okay.
correct.
And yours, the one that you have right now, which I'm going to take tomorrow,
Yes.
is a little different in that it does for the whole fragment. And you said it differentiates between coronavirus, COVID-19, and the regular flu because we're going into the flu season.
Absolutely. Yeah. Yes, it does. It would completely. There is no cross reactivity whatsoever, like with H1N1 or some of the other types of influenza, and even many bacteria in the panel. That we screened a total of 54 different viruses and bacteria just to make sure that we did not detect any false positives that would be due to infection by something other than coronavirus. One other aspect that I just like to mention briefly that just came to mind is that the CDC requires a test like this to be able to detect at least 1,000 copies of viral DNA. So in theory, that means 1,000 viruses. There's many reasons why that's not entirely accurate, but suffice to say that this test is twice as sensitive. It can detect as few as 500 copies of the viral DNA. And you can almost think of this as a second generation PCR, because some of the earlier PCR tests that came out, they were notoriously inaccurate. And I don't have to go through the vendors or the tests. I think we all know that. But suffice to say that the false negatives and the false positives that used to occur with some of these tests, they're never eliminated in any test because it's highly dependent on who and how you take the sample. But we've eliminated most of the guesswork in that, make the test easier to use, it's more sensitive, and you can rest assured the data is much more reliable.
Well, that's reassuring. And I think for everybody listening, and even the docs that are listening, I mean, one, it's a very accurate PCR test. Two,
Yeah.
the ability to differentiate with the flu. I mean, we're in the Northeast, and if listening to the news, listening to the infectious experts like yourself,
Right.
the problem is it's flu season and everybody's going to get nervous. They're going to think they have COVID. And how are they going to differentiate it? Because it'll be difficult. So this test does that. So that's a huge takeaway. So I want that to settle with everybody. I want that to gel. The other thing that you said with the 54 cross-reactivities, meaning the previous rendition or the first edition of the test actually were picking up other viruses and thinking that you were positive. That's why that accuracy rate was a little de-elevated, if you will. So
Yeah.
yours is 54. Could you give some examples of the 54? You don't have to obviously give them all.
Yeah, I mean, for instance, I went through the coronaviruses that, the typical
Right.
one is 229E, the OC43, and the HUK1. I mean, those are biggies. They occur frequently. Very hard from a symptomology perspective to differentiate that from COVID. The symptoms are headache, fever, myalgia, a variety of things, and you say, okay, it could be anything at this point, from bacteria and so forth. Typical things like Haemophilus influenza is a big one. People, is it prevalent? No, but it's frequent enough that you need to differentiate that. It does not pick up Haemophilus, and as well as some of the other seasonal. I mentioned H1N1, but influenza A, influenza B, RSV, a huge one in especially young children and even young adults. Daycare isn't so prevalent today because of coronavirus, but that was a big one for sure in daycare. And then the rhinoviruses, right? Those are very, very typical viruses that cause the common cold. Rhinovirus A, rhinovirus B, and et cetera. Those, and then the adenovirus group, as well as enteroviruses. Enteroviruses are, again, notoriously, it's kind of a nasty group of viruses, but one thing you can say is that the symptomology, while it's not perfectly aligned with corona or COVID-19, it certainly could be in a clinical workup initially be mistaken for that. So those are some of the examples, and we've gone through pretty exhaustively through some of the others. Streptococcus, here's another one. Strep throat, and some of the fungal pathogens, Aspergillus, Mycoplasma pneumoniae in particular. So it's a more indolent type of a pneumonia, but nevertheless, you get a fever, you get a cough, and a lot of the symptoms overlap. And I talk to a lot of healthcare providers these days because of the tests that we offer. And it seems to me uniformly, patient calls, they say, I've got a fever. Patient calls and says, I've got a sore throat or a cold, and they say, go to urgent care. They don't even want you in their waiting rooms. At least at the present time, they're urging people to then go to a more, instead of primary care, they almost shove you into secondary care immediately, which is not only more time consuming for the patient, but it's more costly and a bigger burden on the healthcare system. So if the doc could say, hey, look, they're going to send you a kit, you take a nasal swab, you put it in there, send it back to the lab, and then we'll talk in 2 days, and then we'll be able to determine whether I want to see you in my office and you've got something else, or no, in fact, you have coronavirus, and now we have to figure out what to do from there. And now there's a number of options. The other important thing about what Kbmo offers, and this is absolutely as essential as some of the other characteristics, is that it went from when we receive the sample, we will send a report back to the healthcare provider within 24 to 48 hours. Because heretofore, I think we've all heard at the frustration, you get a test back 7 days later. Now this patient has coronavirus walking around infecting who knows, because they don't know. They're not trying to do it, but they contact other people. So time is of the essence with these tests to analyze it quickly, get the results back quickly, and then you can determine the appropriate treatment.
So as you all know, we're doing a Zoom and a live. So it's we're doing a lot of different things, and I'm actually managing with my phone. So if anybody sees me look down, I'm just looking down at my phone. Really great question. Healthy Natural Solutions LLC.
Okay.
If strep or rhinovirus, etc., shows up, do you receive that info on the test results?
You don't specifically. The test report would address the current infection, which is CoV-2. But what we can tell you is that those are screened out. So it will be somewhere in the fine print, so to speak, that these particular organisms, viruses, do not cross-react, and presumptive, those are, if you're negative, then they could be involved. And if you're positive, could you have a co-infection? Let's get a little crazy here. You probably could, but what this test will do is, do you have COVID-2 or not, with high sensitivity and specificity, and those in general are ruled out, assuming there's no co-infection.
Got another question. They're pumping in now. You better watch out, Dr.
Great.
Dorval. We may miss some tea together.
Uh-oh.
Look out. They were looking for the specificity and sensitivity of this test.
Yes. Okay, so the sensitivity and specificity, or the PPA and the NPA, positive predictive agreement and negative predictive agreement of this test, the PPA and sensitivity is a little bit over 90% when I take the average of 2 clinical studies that were done. When I look at the negative predictive value, it is, we got 99.6 in one study and 100% in another. So that shows you that if you submit a sample and it's a true negative, it will, with over 99% certainty, come back as a true negative.
And so, that's the biggest thing. You don't want you don't want a false negative, because you don't want somebody who is sick to go out without a mask and to hang out in a bar and maybe start a super spreader. The positive, they can always take another test. So then the accuracy in the negative, and that is, we're not going to talk about the regular PCR, but those numbers are better and more accurate than the previous edition of what most people get right now.
Yeah, absolutely. And again, the positive predictive value in the low 90s is, you want it as high as you can be, but you don't want false positives. But by the same token, I think in the previous discussions that I've had with Dr. Silverman, this is highly sample dependent, meaning if you catch that person, if they get infected on day one, generally you're not going to be PCR positive to around day 3 or day 5, and that may continue up to day 10. So if someone just presents as a fever on that day 3 after they've been infected, there's this slight chance that you may miss it. But what we would recommend is, and again, the doctors are very good, obviously, and use your judgment. It may require another test. You may say, look, you know what? This just doesn't make sense from other things that we're doing. We're going to wait another couple of days and then do one more PCR, because we know that we caught you right on the cusp of whether you could be infected. Now, the other problem with some of the testing is the so-called swabbing. The other tests, it's very, very dependent on the skill of the healthcare provider. This takes a lot of that. It's a simple nasal swab. You don't have to have any special training to do it. You just have to do it carefully, aseptically as you can, and it's easy, it's quick, and it's not a deep swabbing. It's not a pharyngeal swab, or certainly not in the category of a bronchial lavage, which is a totally different level, although this test will work on that. So we've tried to get it in the window where you get good acceptance criteria, but there are always going to be little exceptions, and that's just the nature of testing.
Now, the test, as we said, just to reiterate, is more accurate than the
Yes.
previous test, and it's more accurate because it's a second edition. It's also differentiating flu because of the cross-reactivities. We're going to talk a little bit about the cross-reactivities. It's ruling them out. So when you take this test, number one, it's FDA approved, correct?
That's correct.
You did say that before. Number two, it's diff-dying if you have the flu, corona, or both, like you said, in an unfortunate circumstance. And it's ruling out the cross-reactivity where normally you used to get a positive, but you had a different strain of coronavirus. There's
Yes.
something else in there also. I mean, my understanding, and we were talking about before, and I know you want to illuminate on it, is you're also testing for the antibodies, IgM and IgG.
Yeah, so that's the other aspect of what Kbmo brings to the table, is that the PCR test is generally early, the early phase of infection, even the earliest phase of infection. Again, that if day 0 is fever, that 3 to 5 day window after you show some symptom, so very early. Shortly thereafter, you'll develop an antibody response in normal people, and that's pretty much across the board. And what happens there is about, again, day 5, maybe 8, day 10, you generate IgM, which is then followed on by IgG, probably on days, again, 8, 10, maybe up to 15, a little bit delayed. But what that tells you is if you're PCR positive and antibody negative, you've caught that patient in the very, very earliest part of the COVID-2 infection. And what is important there is something very, very interesting. Recently, they treated our president with a couple of drugs. And in that early phase, what they would want to give you is the adenosine analog that shuts down RNA polymerase and replication, is remdesivir. And so, in fact, that's what they gave to him. So there's a decision point for the physician. If this patient looks like they're obese, or they have heart disease, or they're old, they're PCR positive, and you think clinically the outcome is going to be pretty bad, you may say, hey, look, we probably want to think about remdesivir for this patient because it's shown to be effective and definitely decreases hospitalization in terms of the days of hospitalization and the overall severity of the disease. Now, there's the more I want to say esoteric drug, and there's a class of drugs like Regeneron. Those are monoclonal antibodies that bind to the spike protein on coronavirus, and we talked about that previously. That's called the S protein. In particular, it covers the receptor on that, or the receptor site on that protein that binds to the cell receptor, which is the ACE2 receptor. So ultimately, it prevents further infection. It starts to form immune complexes and shuts this virus down via T cell and also other types of responses through complement. So if you catch that patient is PCR positive, antibody negative, you've got a decision point there of, can we treat this patient with either a pharmaceutical, or maybe these drugs will be available shortly and we'll be able to use one. Now, the other thing is the cost, but the other factor too is, does this patient have risk factors? Now, if they're PCR positive and IgG or IgM positive, you know that these patients have progressed into the antibody phase. So while these drugs or these therapeutics may be efficacious, you may want to think about which one to use or exactly how to use them and who to use them on.
That was great. And I think that using the president example is great, because we're watching the Top Care with the Top Tests.
Top Care.
In a tremendous facility. I've got some questions for you. You also got zinc, vitamin D3,
Yes.
and melatonin. So you're
Yes.
seeing now how all the worlds meet, all the different practitioners meet. I've got two questions for you right
Sure,
here.
please.
Top sharer, Lynn Lodo, how you doing? Happy that you can make it. I think she's talking specifically to you. She says, what you're saying is that you don't have to go as deep in a nasal cavity as the other tests.
Yes.
That's question one.
Yeah, that is correct. Yeah, it's a more superficial, if you will. Yes.
So it won't burn quite as much, having taken a multitude of the tests.
I've done it. Yes, it's more superficial.
The client patient can do this swab themselves. She was asking, can they?
In most cases, they can. I mean, again, and that's up to the healthcare provider as to exactly how they present this. I mean, we'd always prefer that it's done in a medical setting. I mean, that's the ideal situation, but there may be more extenuating circumstances where you'd want the patient to do it themselves. So again, I think there's a bit of a judgment call, but since it's a simpler method, I think that it's more amenable to the patient side rather than strictly medical side.
Outstanding. Carmen Leung, what are your thoughts surrounding, and you may not know this because I don't know who this is. What are your thoughts surrounding Everlywell's efforts in developing at-home PCR test as well? And if you're not sure, but here's an open-ended question that you'll love. What sets Kbmo apart? Now talk about a softball.
So what sets Kbmo apart is I'm familiar in a broad sense with what that company does. Good company. They're trying to delve into home testing. What this test does is that this is an FDA-approved test. It's very sensitive and in general better than a lot of the tests out there. I would have to compare what they're using specifically with what we're using. What I can tell you is this test, being FDA approved, has been certified by them, is definitely top flight test. So, and one other factor may be cost. The cost of this test is $150. I think that's a very reasonable test given the information that a physician, a healthcare provider, and their patient gets out of it. I mean, I don't think that that's excessive at all.
I agree. So let's go back and forth. Let's give them the 5 points. Social media loves 5 points. It's FDA approved, or I'm sorry, it's FDA. Yes, it's FDA approved.
FDA approved.
And it will tell you if you have COVID-19 or not. PCR.
It's very specific.
Great. It'll tell you if you have the flu.
It will, yes. Right. It will tell you if you don't have the flu.
Right. It rules out a lot of what you call cross-reactivities, so yes. It has a higher sensitivity and specificity.
That's correct.
And it also gives you the antibodies, IgM early, IgG late. So it's telling you where you are on, if you're positive, you are in the sickness spectrum, if you will.
That's absolutely correct, which is just an important aspect of this, because if the patient is in, let's say, progressing into IgM and into IgG, you can pretty well assure yourself that they're progressing into a convalescent phase, and most of the or some of the antibodies for sure are going to be neutralizing antibodies, much like the Regeneron antibodies, and they will provide protection from that, from the virus. But again, the caveat there is the length is probably only a few months for this particular virus, of the length of protection.
So it's interesting. So if we really delved in, we're not going to go wild in the antibodies. The fact that you have the antibody test with the PCR test will really help you indicate when you're not as contagious, and you can go back to seeing people, etc. So whereas the other one is you either have it or you don't.
Yes.
But if you still have IgM and IgG, you're probably better off staying home a little while.
I agree.
Out.
I agree. And we've had some large groups that have done both the PCR as well as the antibody test, and they're using it for just as you suggest, Dr. Silverman. They're trying to figure out who is infected in their large companies. These are large companies. And can we then not cull them, but that's the wrong term, but simply alert them to the fact that they are infected. And then we can say from the test time, that's day 1, and then count, okay, it may be day 14 that you can go back to work, whatever criteria, but it allows them to put a stake in the ground and say, from this day forward, we're going to count 14 days. And after that, we'll test you again. And if you're negative for, let's say, PCR in particular, then you can go back to work. Now, there's viral shedding. There's some disagreement as to these exact windows in terms of when you're still infectious or shedding. But I think in general, people are looking for some guidance and trying to set reasonable windows so that, we can get back to our, quote, normal lives if that ever happens again or in the foreseeable future.
Without question. So Lynn Lodo had asked you that question before. She's, again, a sharer. Her exact comment, she must have loved your answer, was Kbmo is a top-notch lab.
Great. We appreciate that. Because the lab itself is CLIA approved, and everything we do is under FDA guidance, meaning internally and structurally. So we try to meet or exceed, the guidelines, and we try to really get back to people quickly with results. And if there's questions, we try to get back to them just as quickly to help them move forward. And I'm generally on the front lines answering questions along with James White. But what we're hearing, again, not to pat ourselves on the back, we understand that the customer is important and that information has to be transmitted quickly, and that if there are questions, we have to be able to answer them quickly so that, healthcare can be provided in an optimal fashion. And that's what we try to do.
Outstanding. I mean, I think that resonates with everybody. And I'm happy you really defined the fact about how the quality of your lab, because, so many patients don't realize that that's important. And you're in charge, you're the science officer. That's great. So yes. Now that you mentioned it, how can they get in touch with you?
Well, they can simply go to our website, and there's forms or a number there, and they can contact us directly through the website. Customer service will get back to you right away. We can find out what your needs are, and then whether it's kits for PCR or you need to do some antibody testing, they'll help you work through the paperwork, get that done quickly, get the patient tested, get the report to you. And then just as quickly, if you say, hey, look, I don't understand this, or this doesn't seem right, then you can contact customer service again. In general, it'll be forwarded to myself or to James White. And then what that does is we're alerted and we get back to you and try to get back and answer these questions quickly. And most of the times we have the answers. Sometimes we don't. And if we don't, we'll find it out, and then we'll get back to you in a very reasonable time frame. Generally less than 24 hours is what we try to do.
From receipt. Now, your website has the patient portal, and it also has a doctor portal. So if there's doctors who are interested, they can use that portal right now.
Yes.
And in addition to that, not only do you have the portals, you've got the PCR test with all the things we talked about. You have the antibody test on its own. And lastly, I'm not going to try and get you off the rails, but I will say that you have the best food sensitivity test.
No, thank you.
You know, so you've got your food, you've got your FIT food inflammation test 176. And I've never used more, because if you're worried about this cytokine storm, everybody, if you're worried about having elevated inflammation, one of the best times to ascertain your inflammation and what causes it is to find out what a food sensitivity is and what you're sensitive to. And the problem that most people have, just as an aside, it takes 3 days if you're sensitive to a food to really have the symptomology. So it's hard to know that you ate broccoli and it comes out. If you have an allergy, you know, like to shrimp or a bee sting, you'll feel it right away. You'll get people come in and they tell me their ears are itchy. So your FIT test is great. So for all you practitioners who are looking to do something to help in this COVID-19, 19 pounds or quarantine 15, you may want, again, I'm not trying to get you off the rails. You may want to consider that FIT food sensitivity test. Now, you created that. If you wanted to add a little something before.
Sure. Yeah, absolutely. Well, again, our main business was food sensitivity testing, a test that I developed back in 2004. We patented it, and we manufacture it in our ISO 13485 and FDA registered facility. And then what we do is we analyze samples on the clinical side in the clinical lab, where the COVID-19 samples are analyzed in a CLIA certified lab. Now, what's nice about the FIT test is it's a dual pathway test. And what the heck does that mean? That means we measure antibodies, IgG 1 through 4, that are produced against a variety of foods and food additives, but we also measure the inflammatory component, which is C3D. And we measure IgG and C3D together. So this test is a good indication of inflammation. And what is important about that is when C3A is generated, it's a complement component. It's a big cascade. I won't go through that in detail. I'd put a lot of people to sleep. But suffice it to say that it generates C3A and C5A during the process because of the alternative pathway. And what that does is those are the two of the most potent inflammatory molecules that we have in our body. So while food sensitivity may not be your primary problem, you may have COVID, you may have cancer, you may have some other illness. One thing that's common to all those diseases is inflammation. And if this test can identify a food that causes inflammation and you remove that food from the diet, you'll lessen inflammation and the patient should feel better. Now, it's not going to cure anybody, but the idea is, can you identify a potentially inflammatory food, remove it, and lessen inflammation, and the patient feels better? So that's the goal of this test, is identify the food, get it out of the diet, the patient feels better, and it's because of reduction in inflammation. And as Dr. Silverman said, COVID-19, notoriously, the good news is the patient got remdesivir and is well on their way to recovery. On day 10, the cytokine storm happens, and the inflammation that ensues, and the patient now ends up in the hospital on a vent. That's because the virus is shut down, but now your T cells and everything and are kicking out all these inflammatory mediators and just wreaking havoc on your body, and it's generating huge amounts of inflammation. And that generally is what kills a lot of the patients.
Yeah, absolutely. So the FIT test, food inflammation test, great. Multiple pathway test, or testing for food sensitivities through all the IgGs, IgG 1 through 4, most food sensitivities, IgG 1 through 2. You add it in the complement. This is a great ancillary test to COVID-19, but a great test for overall health to keep your inflammation down. So we've got the PCR test, a new one, Kbmo Diagnostics, Dr. Dorval, it's been my pleasure. One more time, if they want to get in touch with you at KBMO, how can they do it?
Please go to www.kbmodiagnostics.com. There's a phone number there, or there's an email form. Fill it out. Customer service will pick it up. We'll route it to the right people, and we'll get back to you quickly.
Terrific. It's been my pleasure. Hope to see you soon. Thanks so much for all that you do in the world of healthcare.
I appreciate the opportunity to discuss this with you and everyone, and thank you for watching.
We'll catch you soon. Dr. Robbo is yours in health.
Great. Thank you.